views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and their respective stations.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit HSA.KY.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And this one is this one hits home to our community. I have with us a guest, Nurse Campbell, Public Health Nurse and HIV STI Coordinator. Did I say that correctly?
Yes, you did.
Excellent. And the reason why we want to talk to her today is dealing with HIV testing. This is something I think has kind of fallen wayside over the last couple of years due to the pandemic and lots of other things that has been going on. And I just wanted to bring it to the forefront to say, you know what, our young people, elderly people, we need to keep testing and you need to know your status. That was a thing that they had. This was one of the, I would say, taglines that they came out with during HIV testing is know your status. We want to get back to that. And Nurse Campbell, tell me a little bit about the scenario of how to get tested and what does that mean to someone?
Well, it is important for individuals to know their status so as not to infect others and decrease the spread of HIV in our community and globally. HIV remains a public health issue, having claimed 40.4 million lives so far. 39 million people are living with HIV at the end of 2022. So it is important that you get tested so you know your status. Only when you know your status, you can start getting treatment and not infect others. The earlier you start treatment, the better it is for you, so you can live a normal, healthy life.
Okay.
When you start treatment and you become undetectable, you are untransmittable. That means you cannot transmit the virus to other persons.
Okay. Let's backtrack a little bit and talk about because there may be some young folks listening in who didn't go through the HIV epidemic. And I say we're still in it, but the beginning of it, when it was on the forefront of all the TV stations, radio stations, this is coming out of the 80s into the 90s. There was a huge, I want to say, global campaign about HIV and being transmission and detection. Tell us a little bit about how HIV is transmitted.
All right. So HIV stands for human immunodeficiency virus. If left untreated, it can advance in stages. Still left untreated, it advances to what is called AIDS, which is the acquired immunodeficiency syndrome. AIDS is diagnosed when your immune system is badly damaged, and you become susceptible to infections and other diseases.
Right.
It is transmitted, HIV is transmitted through contact with bodily fluid of an infected person. Bodily fluids such as semen, vaginal fluid, breast milk, and persons who abuse drugs. So they will use the contaminated paraphernalia such as the syringes and the needles. And also it can be transmitted from mother to child at the time of delivery. So if a mother does not know her status and she delivers and she was not on treatment, she can pass it on to her child.
Wow. So there's a lot of significant consequences when you don't know your status.
Yes, there are.
And I think that is one of the things that we definitely want to let you and encourage you to know, because only through knowing your status can you stop the spread of it.
Yes.
And in also doing that, how can people protect themselves? Various protection techniques as we talk about HIV transmission.
Various ways in which persons can protect themselves. You should limit the number of sexual partners that you have. Use a condom at all sexual encounters. Not abusing drugs, so the use of the syringes and the needles, and get tested at least twice per year. At least. And
we want to be very clear to say that we're not encouraging you to be sexually active, but the fact that you are sexually active, you should know your position, your status when it comes to this, and also just being able to know where you stand. And always we encourage you, if you are sexually active, please use protection, because you cannot eat, and I'm going to date myself. They had a campaign back when I was in school saying that you cannot look and see AIDS. You cannot look and see HIV. There's no way to say, oh, a person is infected. They don't look, people say, oh, you don't look sick. There is no way of you knowing outside of being tested.
There is no way. You have to be tested. So a sample of blood has to be drawn and tested for the HIV antibody antigen. And then we can know your status. There is no way that you look at somebody and say, oh, that person is infected. No.
Yeah, there's no physical attribute to dictate what's a person HIV or AIDS status. There's nothing to do that. So you need to know where you are simply by being tested. I remember, and I'm going to say, there was a time when people actually required the other person, even going into marriage, to know their sexual status when it comes to this. This was something that was very big in the US. I think they've stopped it since now, but that was something that a lot of people wanted to know when they were entering into a relationship. And this was because, as we said, there's no way of knowing outside of a blood test.
That is true. No way of knowing.
Exactly. So, folks, if you're just tuning in, I'm talking to Nurse Campbell, public health nurse and HIV STI coordinator over at HSA. We're going to take our first break and come right back. We're talking about HIV testing. who should be tested, how we go about testing, and also various ways of people protecting themselves. We'll take a first break and then we'll be right back. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together at 1 p.m. and talk about all things related to your health. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things relating to your health. And this time, we're talking to one of our representatives from HSA, public health nurse, Ms. Campbell. She is here to talk to us about HIV and also STI. She's the official HIV STI Coordinator over at the HSA. And before we left, we were talking about how important it is for someone to know their status when it comes to HIV. Outside of that, how early should they be looking to be tested? Are there any concerns, any red flags, or just for a better health outcome?
Yes, for a better outcome, you should get tested. Early detection will contribute to a better health outcome. The sooner you know your status, the sooner treatment can commence. Testing is the first step in knowing that if you are positive or negative.
Okay.
As we had said before, you cannot look at somebody and tell that they are positive or negative. It's just through testing. If you get tested and you should find that you're positive, then we will assist you. You will start your medication, which will assist you in getting to an undetectable state where your viral load has reached a stage where you cannot pass it on to anybody else.
Okay.
Yes. We offer counseling. We offer nutritional guidance. And if you are having any issues, you can always come into me at the office and we discuss.
Okay. I think a lot of people, and this is just things over the years, a lot of people have been afraid to know their status. And I always say, you know, afraid of the knowledge isn't the problem. The problem is what happens after you find out. That's what they're afraid of, because either you are or you aren't. There's no in between. So I think that the thing that we're trying to let people know is know your status. Be able to confidently know your status for yourself, because only that way can you stop transmission if you are, or prevent transmission if you're not. Because if you're not, you are going to want to insist on protection, because that is the only way how you can stop transmission right now. Would I be correct in saying that, nurse?
Yes, that's the only way we can stop transmission, through testing, knowing your status, and preventing you from passing it on to others in the community.
Yes. And I think that is a great idea. How early can you find out detection wise? So say, you know, for all lack of intensive purposes, if it's, you know, folks, in mind you, I'm trying to speak in layman's terms. If 0 is it and 0.1 is positive, how early can you find out that details?
With our new antibody test, the 4th generation test that we conduct at HSA lab, you can find out at least 6 weeks after being infected.
Okay.
Yes.
Exactly.
Yes.
And folks, you have to understand, this is, you know, 30, 40 plus years that we're talking now of information, testing, trial and errors. The equivocation of knowing your status has literally been the saving of many lives. And I always, you know, when it comes to HIV testing, I always use one of the most famous people in the world when it comes to it, none other than Irving Magic Johnson. I remember watching him on TV talking about his status of HIV. And people were saying, you know, and folks, we try to be honest about it. People were saying that it's a death sentence. He won't live this long. He has lived 30 plus years with HIV and thriving as a human being, as a businessman, as a person. So it's not a death sentence by no means and no accounts.
No, it is not a death sentence. From you are tested, you know your status, you commence your treatment. There is no cure, but the treatment controls your HIV, the viral load. It's a life treatment of a tablet per day.
Okay.
Right? You take it and you can live a healthy, normal life. Ensure that you exercise, have a healthy diet, and you can live a productive, normal life for as long as the normal person who is not infected.
Right.
Your longevity has increased from you take your medication and remain positive. Take the medication and you will be
continuing on the
for life.
Which brings me to the question, if you can explain the testing process, because we're diving into it, saying it now. We're at that stage. You know, I'm saying, okay, I'm, you know, for all intents and purposes, I'm not a woman, so I'm not having a child or childbirth, but I need to know my status because I'm sexually active. How does that process get started from the testing side?
Okay. You decide you want to be tested. There are various locations that you can come in the HSA to get tested. But I am located at the general practice, so you can come there Mondays and Wednesdays to get tested. We offer testing at West Bay 1st and 3rd Fridays of each month between 10 a.m. and 12 p.m. Buntown Health Center 1st Mondays between 9 a.m. and 11 a.m. East End Health Centers 4th Wednesdays between 9 a.m. 11 a.m. Northside Health Center, second Wednesdays, 9 a.m. to 11 a.m. at the Red Cross building at Holder Road, every third Tuesday of the month between 10 a.m. and 2 p.m. So those are the areas that you can go and get tested.
Do we need to make an appointment, or is it just like a walk-in?
You can just walk in.
Okay.
Yes. But if you want to make an appointment that is conducive for you, that is out of these times, then you can call 938-4703 to make an appointment for a time that is conducive for you.
Right.
Yes.
And I just wanted to reiterate, folks, because we're talking about HSA, all of the information is confidential. We live in a time where information is king, but they go to great lengths to protect your identity, protect who you are when it comes down to your health concerns. And this is a pretty routine action for them. This is across the board. They treat it just like any other situation when it comes to HSA. You walk in, you give them your name, the age. They take all the preliminary information, but your confidentiality is at their utmost understanding.
Yes, confidentiality is at utmost. It's a prime in you getting tested. Because when you come in for testing, it's in a confidential area. You will have pre-counseling. It's a one-on-one pre-counseling. We assess your risk profile, and we explain the actual tests so that you understand what will be done. And as I said, it's confidential. So when you come in, get your test done, it will not be emailed, the results, whether negative or positive. It will not be emailed. It will not be WhatsApp. You will not see it on your profile. You have to come in so we can discuss what is on the results.
That's very reassuring, because people may be hesitant to do the process due to, I always say we have a very small community, but our community, when it comes to our healthcare facilities, are very confidential and very private. So folks who haven't done the process before, as you said, you should be tested at least twice per year from the time that you are sexually active. And I'm just talking from that standpoint, because most of our younger adults would start at that versus childbirth. You have to get from one to the next.
Yes.
So that information is helpful in going forward if you're thinking of having children, if you're sexually active, whatever the status needs to be, you need to find out that prior to involvement with people. We're going to take our next break, folks. If you're just tuning in, we're talking about HIV and also STI. We're going to come back to some of that part, because we've been kind of focusing on the first half of the show for HIV, but also we want to talk about sexually transmitted infections and find out a little bit more of that from their public health nurse, Nurse Campbell, right here. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things relating to your health. We do this at 1 p.m. on Fridays, and we rebroadcast on Saturdays. So stick and stay. We'll be back in just a few moments.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, talking to you about getting tested for HIV, but then we're going to also do a switch and talk about STIs also. We have with us a public health nurse, Nurse Campbell. She's here with us, and we've been talking about where people could get tested, but apart from testing, what other services can people seek concerning HIV?
Apart from testing, we offer counseling, counseling about the HIV, STIs, your medication, nutritional services. We offer for you to see the general practitioners, and also we offer education. We educate. We will go out and educate persons HIV and STIs. Right.
And I think that's really good because a lot of people who in the past have been put into this scenario may not have had that mental side of it, to have that information, to have that counseling, to have that concern. And also nutrition. You brought up nutrition, which I think is really a grossly understated thing in the past years. It's come to the forefront that you need great nutrition for medication and also just for your body to react to things in a positive manner.
Yes, you do. You do. Because you need to know the healthy foods to have and how to prepare a nutritious meal that is good for persons who need to know that what they are having, and the balanced diet is of utmost importance for whether you're HIV positive or negative.
Right.
Yes.
That is definitely a must. And I'm glad to know that our Health Services Authority is looking to that supporting of nutrition and also knowing what medication is, because a lot of people take medication, but they don't know what the effects are. You know, certain medications, if you take certain other things, they have certain side effects. Knowing that maybe you're on another painkiller, maybe you're diabetic, you just don't know what the implications will be. So it's great that you have that service that allows them to seek more information concerning medication and things of that nature. So, Nurse, let me ask you this. Let's change a little bit of a switch and talk about STIs. You are the STI Coordinator along with being the HIV. Tell me what that consists of. How does that different or does it different?
STI, sexually transmitted infection. It's a list of sexually transmitted infection along with HIV. So we do test for syphilis, gonorrhea, chlamydia, hepatitis B, hepatitis C, HTLV, and herpes. So we offer guidance on how to prevent you from getting these sexually transmitted infection. If you're tested and you're positive, then you will be offered treatment, because the sexually transmitted infections, they can be treated with the use of antibiotics.
Okay.
Apart from HIV, syphilis is another debilitating sexually transmitted infection, but it can be treated with antibiotic.
Okay.
Yes. HTLV is one of those rare sexually transmitted infections that there's currently no treatment for that one. Yes. But as I say, rare.
Okay.
Yes, it's rare. The most common of the sexually transmitted infection being the chlamydia and the gonorrhea. And those are easily treated with antibiotics.
Okay. So I know we have a lot of, and this is kind of for the younger population in our community. A lot of them may be hesitant, maybe, I don't want to say unsure, but not motivated to get tested or seek information. This is a forum for us to talk to them. What message would you tell them if they're listening right now?
If you are sexually active, you need to get tested. Because when you're tested, you know that you are not transmitting any infections to your partner. When you're tested, you'll be thoroughly treated. We encourage you to ensure that you use a condom at each sexual encounter. I also offer condoms, so you can come into the office and you can receive condoms.
Okay.
Condom is the only contraceptive that can protect us from getting sexually transmitted infections. So it is important that you use a condom at each sexual encounter.
Exactly. And once again, I always throw this out there. It doesn't matter your race, doesn't matter you male, female. It doesn't matter who or what you are or what you do. You need to protect yourself.
Yes, you do.
And the way how you do that is through a condom.
Yes.
And they even have, I don't know if they still do this, but they used to have condom education, because at the time, and I'm dating myself, there was a huge difference between condoms, plastic and latex and things of that nature. So a lot of people were not using condoms properly. And I'll just say it in that way, because there was not regulation for it. Now we have great regulations as we move forward, and you're able to buy condoms in grocery stores. You're able to buy condoms in gas stations. You're able to buy condoms elsewhere, and you also offer them free.
Yes, free of cost.
Free of cost, right?
Yes.
And that was one of the big things that young people saying, I didn't have money to buy condoms. You offer them free of cost. Free of charge.
Yes, free. They come in and they can get some condoms.
Exactly. So there's really no reason for you not to protect yourself.
Absolutely none.
Exactly. And that's kind of what I would like for people to know. Once again, we're not encouraging you to go out there and have sex. We're not telling you that, this is a byline for you, but you need to be safe. You need to know your status. You need to protect yourself, your community, and your partner that you're with, because they may not know their status, or they may not want to know their status, but you know what your status is and you're trying to protect it by using a condom. And in that way, you're helping yourself as well as them. You have to be responsible, folks. It's all about taking responsibility for your actions. And that means, if they wanted to come into your office in the HSA, how can they find you over the HSA?
I am located at the Smith Road Medical Center on the second floor in general practice. They don't have to say, just ask for Nurse Campbell. May I speak to Nurse Campbell?
Right, exactly.
Yes. And you don't have to say why you're there. I'm here to get some condoms. Yes. May I speak to Nurse Campbell?
That simple, that easy. And I think Nurse Campbell, the fact that your name is there and they know who you are, that sense of I'm nervous. Just come in and simply ask for you. You don't need to give a reason. No. You just need to ask her. And then once you get in private conversation, they can ask what they need to ask with you.
Yes.
I think that is great. Folks, we're going to take our next break, and then we'll come back and talk about the hopes and goals in the future for HIV awareness. We'll be back in just a few minutes. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor, talking with Nurse Campbell. She's the public health nurse and HIV STI coordinator over at the HSA. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m., we get together and talk about all things relating to your health. We do this live on Fridays, and then we rebroadcast it at Saturday at 1 p.m. for anyone who's missed it. And this time we're talking to Nurse Campbell. She is the public health nurse and HIV STI coordinator over at the HSA. And we're started off initially, and let me just go back to it for anyone who's just tuning in, about how HIV is transmitted. Most people think that it's only a sexually transmitted disease, but it goes beyond that. Would I be correct in saying that, nurse?
Yes, it is transmitted through sexual contact and exposure to infected body fluids.
Okay.
So the semen, the vaginal fluid, breast milk. So for an infected mother breastfeeding, the child can be passed on to the child through breastfeeding and blood products.
Through childbirth.
And childbirth, mother to child transmission.
Okay.
Yes, and the use of contaminated drug paraphernalia, the syringes and the needles.
Okay, yeah. And that, I think, brings us to the next thing. You don't know who has it.
No.
So it is better to protect yourself, because in protecting yourself, you're protecting the next person also.
Yes.
And that can only be done when you know your status.
Yes.
You need to be aware of your status. And it is pretty easy to do. If I wanted to know my status, Nurse Campbell, how would I do that?
You get tested.
Okay.
You get tested. You come into any of the health centers that I had mentioned in those times. So you can come into the general practice at the Smith Road Medical Center Mondays and Wednesdays between 9 to 12. West Bay Health Center, 1st and 3rd Fridays between 10 a.m. and 12 p.m. Bontown Health Center, 1st Mondays of each month, 9 a.m. to 11 a.m. East End Health Centers, 4th Wednesdays, 9 a.m. to 11 a.m. Northside Health Center, 2nd Wednesdays, 9 a.m. to 11 a.m. Red Cross Building at Holder Road, 3rd Tuesdays, 10 a.m. to 2 p.m.
Excellent. And you literally are taking this to the district clinics for the people. So you don't have to stress yourself trying to get into Georgetown all the time. You have made it very accessible in all of the districts, depending on the days of the week, that they can come in, confidentiality, and be tested. And also, if they need to make maybe one of the times don't coincide with their busy schedule, how can they reach out to you and kind of make an arrangement to see you outside of these times?
Yes, they can make a telephone call to 938-4703, and we can work on a time that is conducive to that individual. Thank you.
So, in moving forward, what would be the hopes and the goals for the future of HIV awareness and testing in our community? Because I think we're starting off on a good foot, but where should we be going? What are the hopes and the goals?
Some of the hopes and goals is for persons to not be afraid to come in and get tested. We want to increase the number of persons tested so you know your status. Also, we want to impress on persons the use of condoms, to increase the use of condoms in the community. And because condoms, we have made it accessible. Cayman AIDS Foundation makes condoms accessible to persons at different bars and locations that they can get it free of cost. So there are some condoms distribution kiosks at some of these areas that they can get it.
Right.
And we want to reduce the stigma that is surrounding HIV. Stigma is rooted in fear. So we want to reduce the stigma through education. Because if somebody does not know what HIV is, then they are going to be showing discrimination towards somebody who has it.
Right.
And if they know what it is, how it is transmitted, that it cannot be transmitted through shaking your hands, sharing utensils, hugging, then they will know that
the knowledge and awareness needs to expand.
Yes. And that will be done. That is done through education.
I think that over the years we have watched the information highway expand the idea of what the real scenario is when it comes to HIV. You know, for a very long time, it was seen as a specific genre, disease or infliction or a problem, but then it became a global problem. And then everybody was aware of it. And then it wasn't, it wasn't a black disease. It wasn't a white disease. It wasn't, it wasn't selected to a certain demographic or population. And I think that is where we need to understand that information, education is the key, because only through knowing how it can be transmitted and why it can be transmitted is how you can stop the transmission of it. Yes. I think that, that is one of the keys for bringing awareness in our community. I myself saw a kiosk in a restaurant, a condom kiosk in a restaurant bathroom. And I thought to myself, wow, that is so progressive. That would have never happened to me as a young man in my lifetime. But yet I know of several people that have been afflicted by HIV and AIDS because they didn't have this access. They said, oh man, if I could have had $5 or whatever it was at the time to buy condoms, and here it is being offered free.
Of course.
It could save someone's life.
Yes.
And that is, I think, where we need to understand and go with the information, and also have that an education that someone is not afraid to come and sit down and talk to you about it, to come see you and think, oh, wow, because I'm seeing her, people are going to think any different of me. It could be that you have just saved their life with this, because it's a lifelong thing. You're not thinking that, even at a negative count, you still have had that. So you've had to go through that stage, and you had to go through the understanding that I'm no longer transmittable, but I had to take the medication. I had to be aware to get to that point, and understanding that, the testing was required for me to understand that I did test positive. I took the medication. Now I'm testing negative. So you had to be able to start the process. So just in wrapping up, a nurse, are there any upcoming events or initiatives that our listeners can look forward to hearing, and what should they know?
Some upcoming events where you can get tested. Cayman, Little Cayman will be having a health fair in July. You can listen out for the date where they will be offering free testing for HIV, STIs. Hepatitis testing week is coming up. In that week in July, we will also be offering testing for HIV and all other STIs. And in December 1st is known as World AIDS Day. And there's a week which involves the 1st of December where we offer free testing also and education. Excellent.
Once again, if someone wants to reach out and have a conversation with you, or maybe call to find out when you're available in their district, how can they reach out to you?
Okay, they can call 938-4703 or 244-2587.
Okay, excellent. Thank you so much, Nurse Campbell, for stopping by here today as we talk about HIV testing and STI testing. If you just tuned in, we were talking with a public health nurse and HIV STI coordinator, Nurse Campbell. Thank you so much for stopping by here this afternoon.
Thank you for having me.
Folks, don't forget, go on ahead and get tested. Don't let the stigma, don't let it get in your head. You need to know your status when it comes to all of this information. It will help you move forward and continue to be productive right here in the Cayman Islands. Thank you so much.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.